It's the most expensive healthcare problem in the United States today. An estimated 80 million Americans suffer from it, and it's been called a silent epidemic. What is it? Stay tuned to this edition of Healthy Living and find out. Hello, and welcome to Healthy Living. I'm your host, Tammy Thompson. What could cost more than $100 billion a year to treat and be so invasive for some that it's hard for them to do simple routine tasks? It's chronic pain. And here to talk about what chronic pain is and how to manage it is Dr. Daniel Keck, a local specialist in chronic pain management. Welcome, Dr. Keck.
Good morning.
First of all, let's just talk a little bit about yourself. What brought you to Paducah and what made you decide to practice chronic pain management?
Well, actually, I probably consider myself to be a native. Even though I was born in California, I moved here when I was in high school and went to college here at PCC for a couple of years, and then went to Murray, and then went off and did a whole bunch of other crazy things, and eventually ended up back in medical school. And when I graduated from medical school and completed my training, when I thought about where I wanted to go practice, coming back to Paducah was like coming home.
Why chronic pain management, though?
Well, at first sight, it looks like kind of a difficult thing to practice. You're dealing with patients who have a lot of emotional problems, a lot of problems that may not get significantly better quickly, but it's a very satisfying thing for a doctor to take care of, because a lot of times these patients have seen lots and lots of physicians in the past. And if you can be the one in that long line that makes a difference, it's a very satisfying, lifestyle.
Well, let's talk a little bit about what you do then. What is chronic pain?
Well, I think the first thing that we should do is define what pain is.
Okay.
It sounds like a simple thing. Everybody's had pain. Everybody should understand what it is. But in order to effectively treat pain, we have to know what the heck we're talking about. And believe it or not, the definition of pain is something that took a while to develop. It actually took a group of doctors from across the world to sit down together and decide what pain means. And they came up with a fairly complicated definition, but one that's important because of the parts that it includes. First of all, they decided that pain was an unpleasant sensory or emotional experience. And then it should be associated with either actual or potential tissue damage, and then described in terms of that damage. And that's a mouthful, but if you break it down into its individual pieces, each piece is very important. And the first most important part of the definition is that it involves both sensation, or the feeling of pain, and the emotional experience that generates. The second part is that it includes both actual tissue damage and potential tissue damage. So the threat of being hurt is part of what pain's all about. As far as we know, humans are the only creatures that can suffer, and suffering is a big part of what pain is all about. Once we understand what pain is, we have to break it down in a way that we can understand it, and then most importantly treat it. Most doctors have decided that there are convenient ways of classifying pain, and one of the most convenient ways we found is to classify it based on the kind of pain the person's suffering from. And believe it or not, there are different kinds of pain. The two basic types are what's called nociceptive pain, which is a $10 doctor word for the kind of pain everybody's had. It's injury pain. It's the kind of pain you experience if you cut your thumb, or
quick, acute onset kind of pain.
Right. Pain that happens, pain that's important, that serves a function, which is to tell us something bad is happening, we need to avoid it, we need to get away from it, and then pain that goes away once it's served its function. A second type of pain is neuropathic pain, and this is actually caused by injury to the nervous system, injury to a nerve, to the spinal cord, to the brain, and it's a very different kind of pain. It's very difficult for patients to describe it. When they do describe it to me, they use very theatrical, elaborate descriptions to try to give me an idea of what it feels like.
Like what?
Well, I've had some patients tell me a very typical thing that they say is that it's a burning, stinging type pain. But in order to convey to me the intensity of it, they talk about things like, I feel like my leg is being stung by 1,000 hornets.
Okay.
Or I feel like a piece of barbed wire is being pulled out of my leg. So they're very descriptive, but the point is that they're trying to describe to me something that most people haven't experienced.
And there's no wound, or there's nothing to show, to treat,
Right.
to know what to do.
I think that's very important. They're describing something that you can't see, that you can't measure, and that perhaps many doctors have looked at and just shook their head and say, I don't know what it is, and I don't know what to do about it. So
that can be devastating for someone to go to a doctor, because when you go to a doctor, you're looking for help. You're hoping that when you go, they know what it is, give you some medicine, you go home and you're finished with it.
Right.
And to be told, I don't know what it is,
Right.
can be very hard for a person to accept.
And it's difficult but important for patients to understand that, and to understand that we're dealing with something very different from what they may have experienced in the past, because the treatments that we use that we find are effective are very different than the treatments that have been tried already. So a lot of it has to do with convincing the patient that what you have is different and unique, and it may take something different and unique to fix the problem.
Okay, we're going to talk about a little bit of those treatments later on in the show. So is what you're describing now where chronic pain falls into?
Well, yes, it is, and that's where we get into the other way of looking at pain is a timing issue. Pain that we experience right away from an injury, doctors refer to as acute pain.
Okay.
Chronic pain is something different than that, but the definition of chronic pain has also been debated. The easiest and simplest definition that was originally put out there was a matter of timing. Pain that's persisted for a long time. Somebody decided a long time means 6 months. So
Okay,
one
that's
of the
a long time.
definitions is pain that's persisted greater than 6 months.
Okay.
That's kind of a simplistic sort of definition because some people have chronic pain that lasts less than 6 months, and many have chronic pain that lasts much longer than 6 months. So I think a better definition is pain that persists beyond the usual course of a disease or beyond the healing process that normally should occur. So it's pain that comes on because of a reason but doesn't go away when that reason goes away.
And what could be some of the reasons that would bring on a chronic pain situation?
Well, one of the things that we're beginning to understand is that chronic pain is not just an issue of timing, but an issue of how the nervous system functions, or how it doesn't function, to be more specific. Normal people that have pain have a nervous system that in many ways can adapt to that pain and eliminate it as they're completing the healing process.
Okay.
For example, you cut your finger and it hurts initially, but it doesn't hurt for the week it takes for the wound to heal. And that's
Okay.
because your nervous system has a way of dealing with that and overriding those pain signals while it's completing the healing process. Chronic pain sufferers, we think, have a nervous system that doesn't work like that anymore. They're not able to override the pain signals because they're persistent and constantly there. We actually have ways of measuring the brain and the function of the nervous system, and we see fundamental physical changes in the way chronic pain patients' brains and nervous systems work, as opposed to you and I.
So their body, is it a nervous system problem all around? That it's just their nervous system doesn't function the way it should, or is there something else that just, some people have different levels of pain, I guess is what I'm saying. Some people can live with an amount of pain and be okay with it, and some people can't. So because people are different, it's probably very hard to figure out what needs to be done and whether or not that they can live with what's going on with their lives.
Well, that's part of the big challenge of taking care of chronic pain patients is their pain is different from person to person. Their response to the pain is different from individual to individual. And we're finding all kinds of interesting things out about how people perceive pain and how they process it and how they live with it and deal with it. There was an article in Time magazine several years ago with a cover with the announcement that men and women are different. And I thought that was just astounding that it took someone a lot of research time to publish that result. But in all seriousness, what we're finding out is that men and women's nervous systems function differently. So they perceive pain differently, they handle pain differently. Medications that work for men don't work for women, and that kind of thing. So you're right, there's so many differences in individuals.
Not just men and women, but women and women and men and men, they're all different.
That's right.
So let's talk about some of the symptoms. You talked about, I guess it depends on where your injury is or where your pain is, depends on the symptoms. But what are some of the primary things that you see when people come in and they say, I'm hurting all the time?
Well, one of the most important things initially when I first see a patient, the most important thing is to listen to them for a long, long time. There's a very famous doctor that trained physicians who made a simple statement, which is, if you listen to patients long enough, they'll tell you what's wrong with them. Now, we have all kinds of expensive tests and things that we can do, but the initial thing that has to happen is you have to listen to the patient and listen to not only their description of their pain, which can send you in the correct direction as far as diagnosis is concerned, but also to listen to their experience of the pain, which is probably a much bigger part of what the problem is than just the simple feeling of pain.
Mm-hmm. Well, what seems that's unique that you say that, because it seems more and more that doctors aren't taking that time because they have so many patients, and you go in and you talk to someone in the waiting room, and what time's your appointment? Well, my appointment was at 1 o'clock. Well, mine was too. Or mine, and you're thinking, how come that we have the same appointment time and the doctors get behind? And so how do you remedy that? Because like you said, you have to listen for a long time to figure out what's going on.
Well, I wish I did have a remedy for it, but I don't. I get behind just like everybody else does. Part of the problem is the way doctors look at pain, the way we've traditionally seen pain. Doctors are trained to identify or diagnose a physical ailment and then apply whatever therapeutic remedy or medication or whatever it takes to fix the problem. We can't see pain. We can't measure it in many ways. We can measure its effects. We can see its effects on the body. Occasionally we can identify a causative anatomic lesion to account for the patient's pain, but sometimes we can't. Now, traditionally, we look for tissue damage or an injury, and then we look at the severity of that damage, and then we make a guess as to how bad the pain should be associated with what we see. The problem is with chronic pain patients, they have a nervous system that's gone awry, and their response to pain is now greatly exaggerated. So we may not find tissue damage that accounts for what they're telling us they feel. And in that case, we run into questions about the patient's sincerity, or we wonder if maybe that is not really pain that they're suffering from, but something psychologic. And that's the unfortunate part about treating chronic pain patients. They've been to see doctors who have employed these traditional methods of evaluating their pain, and it hasn't worked out, and they haven't been able to communicate what's going on, and their doctors in many cases haven't been able to communicate back to them what they think they should do to treat it.
And what happens next? Stay with us. We're going to be back in just a minute to talk more with Dr. Keck about some of the statistics that are out there on chronic pain and what happens after the diagnosis comes. Thank you. We'll be right back. Welcome back. I'm Tammy Thompson, host of Healthy Living, and I'm talking with Dr. Daniel Keck, a local specialist in chronic pain management. We talked in the first segment, Dr. Keck, about what chronic pain is, and we're going to get into some of the treatments and those remedies that you said are different from traditional medicine. But before we do, I want to get back. Can anyone at any age hit with chronic pain? Or is it something that, is in older people?
Well, it can strike anybody at any age.
Young people too?
Young people too.
Okay.
I've taken care of several patients in their teens
Okay.
who've had back pain or pain for months and months and haven't found a good reason for it yet.
Why is it called the silent epidemic?
Well, part of the problem is that silent comes from the fact that people suffer in silence. They don't make it known to everyone because it's something that goes on and on.
And after a while, Dr. Keck, excuse me for interrupting, that people get tired of hearing you complain.
Well, that's what I was going to say. This not just affects the patient, but
Right.
it affects their family, it affects their coworkers and their relationships. And you're right, to a great extent, people get tired of complaining and they stop complaining. They continue to suffer.
Right, because you see people go, oh, here she goes again, or here he goes again. You can't be hurting like that all the time. And so they just withdraw and stop talking about it altogether, you think?
That's correct. And then the other part of a silent epidemic is the far reach of who's being affected by this. We're not talking about some isolated people that are out there somewhere. We're talking about millions and millions of Americans. It's a huge burden to society. Some estimates are that up to a third of all citizens in the United States suffer from chronic pain of some form or fashion. For example, back pain is a common cause of chronic pain, and back pain is the number 3 presenting complaint at doctor's offices.
What's number 1?
Pain of other sorts. Pain is a common presenting complaint.
Just pain all over, maybe.
Of one sort or another, yeah.
But back pain's number 3 that you hear most common.
Yeah,
Okay.
it's a very common complaint of patients. It's a very common cause for admissions to hospitals.
Okay.
And then we look at the cost of this epidemic, and it's huge. There are indirect costs and there are direct costs. Direct costs.
Is that where the $100 billion figure comes from, indirectly? And
the direct cost that we can measure in lost productivity, lost work, has been estimated from anywhere from $11 to $65 billion a year in the United States alone. When we add in indirect costs,
loss of work,
loss of self-esteem, not just absenteeism from work, but presenteeism.
Right.
People there that can't function to their best ability. When we look at the costs of substance abuse and other issues that are involved in chronic pain.
that's a concern. Substance abuse from not just trying to treat the pain, but maybe, psychologically as well, just trying to numb it all.
Trying to treat the suffering that we
Right.
talked about. We add all those things in together, and there's no firm estimate, but $100 billion is probably a very conservative estimate. It's probably much more than that.
Well, once they get, let's ask how they get to you. They've probably seen lots of doctors and have not received any help, like you said. How do they know they need to come to a pain management specialist?
That's an interesting question, because most patients that show up aren't real sure what pain management means.
Mm-hmm.
I'm not even sure if I know what that means. It's a term we've coined to talk about what it is that I do. Management is kind of an interesting word because it implies that this is something that's going to be ongoing, that it's
cure.
not going to stop, and that's an important point. But many patients don't understand what pain management is, and that's part of the time it takes to see the patient. Is not only am I going to listen for a long time, but I'm going to do a lot of educating also, so that they understand what it is they're suffering from and what might work.
Do other doctors know that after a certain point they maybe refer a patient to a pain management specialist, or does someone just call and say, I've been to lots and lots of doctors and I've received no help and I have to do something else? How does it?
I think most doctors that refer patients to me understand kind of what chronic pain is. It's basically a feeling that I've tried to take care of this patient for a long time and I haven't gotten anywhere. And maybe there's something I don't know, and that's when they send them to us. There's also this unwritten sort of rule that if the patient has suffered from pain more than 6 months,
Okay.
they need something different.
Right, so that's kind of the cutoff point. After 6 months, then we need to do something different. Once they get to you, what's the first thing you do? What are the tests and kinds of things that you go through as far as actually diagnosing someone with chronic pain?
Well, the first thing that we need to do is collect information. I have to have a good understanding of where they've been, what's been tried, what has or hasn't worked, and that takes a lot of information gathering. So as a preference, we like to have patients referred from either
Okay.
their family doctors
Plus
or
their medical records come along with that.
right, so
to
that
help you.
we can get a good idea of where they've been so far, and that's mainly to save time.
Right.
Once we sit down in the room with them, then it's their time to shine and their time to talk. And that's mainly what goes on. I like to listen for a long time. I may have to direct and ask particular
Right.
questions, but most of what I'm going to learn about their experience of pain is going to come from what they tell me.
So once you have found out they've had pain for more than 6 months and they've told you about all the things that you need to know, what's next? What kind of treatments are available, for people who suffer with chronic pain?
There's a variety of things that we can do. And
The other remedies that you're talking about.
Right,
Okay.
and one group of doctors will tell you the best way to do it is to identify a particular problem and work on that particular problem. But like I said, a lot of times we can't find a particular problem,
Okay.
or the experience of the pain is much bigger than the parts.
Right. Or it may start here, but that's progressed to something else.
Right.
Is it important then to get it, kind of nip it in the bud, so to speak, so that it doesn't progress to some other level of...
That's a very, very good point. And the first tool of the trade in treating pain is something that I don't do. It's something that the family practice doctor does who sees a patient with pain, and that's to treat acute pain aggressively, because we know that pain that persists for a long period of time changes into this ugly monster called chronic pain that's very hard to treat with traditional methods used to treat pain. So treating it aggressively is the first
Okay.
step.
All right. And once they've done that, the medications, and then I have here, like, they can get injections or implants for kinds of treatments. Can you kind of briefly describe what those are?
Well, there's all kinds of treatments
Okay.
available,
Okay.
and generally the thought is we should use less invasive, less risky treatments first,
Okay.
if that's appropriate, and then progress on to more invasive and more risky type
Okay.
treatment. We don't have to go in a stepwise fashion. We can use different forms of therapy in parallel, but there are all kinds of things we can do. Some of them are non-invasive and involve what most people consider as treatment for pain, medications.
Okay.
They may involve behavioral approaches to pain, where the patients basically learn how to use the nervous system they've got to fix the problem.
Okay.
We do a lot of referral to specialists to use guided imagery and hypnosis and all kinds of things that sound very strange but actually work very well.
Depending on the person,
And,
depending on what their pain is and what works for them. And I think that's very important to bring out again, that what works for one person is not going to work for someone else.
Well,
And that you have to be persistent enough to keep going until you find out what works for you.
that's right.
But there is something that we briefly want to talk about called chronic pain syndrome. And you said that was an overall encompassing, not just physically, but...
Well, it gets back to this whole point that chronic pain is a unique thing, very different from normal pain. And we've coined this term chronic pain syndrome to describe all of the pieces and parts that go into the patient's experience of the pain. The first thing is I have persistent ongoing pain. We also look at things like the facts that their complaints of pain are greater than the physical findings that we can see and measure. Most chronic pain patients are deconditioned. They haven't been able to exercise.
Okay.
They may have very severe problems with sleep, which we know is vitally important
Right.
to helping them get better. Most will have depression in some form or fashion. And then there's various degrees of disability that are involved related to
So
their
this isn't
pain.
just physical, is it, Dr. Keck? I mean, you've said that before, but I just want to reiterate that point. This is emotional, psychological, maybe even spiritual to a certain point, because they've prayed and prayed and it's still there, and they're just having a really hard time all around, plus their family that you talked about, and their friends.
Well, every presentation on chronic pain I've ever seen begins with a pie chart that shows the pieces and parts of what chronic pain is. And one of the very, very small slices of the pie is labeled nociception, or the sensation of feeling pain. And all of the other parts of the pie are much, much bigger.
Much, much bigger.
So the emotional burden of chronic pain is far more significant than the physical burden.
Well, I've learned from personal experience that when you feel bad emotionally, then you feel worse physically. So it builds on that. You already hurt, and then when you're depressed about it, it just seems to compound that and make you feel worse physically. Let me just ask you this question. We have a few more minutes in this segment. What, outside of the treatments that you said, what can patients do themselves to make themselves feel better?
Well, that's a very key point in that these people are people who have been treated for a long time, and the point is they've been treated by someone else. They haven't treated themselves because they haven't been made part of the solution. Mm-hmm. And that's a big part towards helping them ultimately feel better, is involving them in their treatment, giving them some control of their life back, because in a big sense their life is out of control.
Right.
It's been taken over by pain.
Every aspect, work, play, church, everything has been taken over, and it's almost, is it all they can think about at times?
In many cases it is, and part of the treatment it may not be related to getting rid of the sensation of pain. We know now that things that work are what we term pain rehabilitation.
Okay.
Looking at the whole broad picture and treating the psychological dysfunction that goes along with pain, physical reconditioning, efforts to get them returned to function are the most important thing. Get them back into life doing something besides worrying about their pain.
A much more holistic approach to healing.
Right.
Will all the pain go away? Or is there some level of acceptance for someone who suffers from chronic pain?
It's a very good point. At just about every chronic pain patient at some point in time, be it early on in treatment or much later, comes to the realization that they're going to have to live with a certain amount of physical discomfort. The goal or the key then pushes those that succeed on is realizing that that physical discomfort is not going to be what makes up the rest of their life.
What controls their lives.
And sometimes that's a very defining moment. Mm-hmm. Sometimes it occurs gradually. But just about every patient eventually will come into a follow-up appointment somewhere along the line and say, I've realized that I'm not going to get completely better from a pain standpoint, but I'm not going to let it ruin my life.
So that they learn, then their coping mechanism kicks in. And some of those other doctors that you may have referred them to help them deal with it psychologically then can also help them to deal with what they have to every day.
Right.
Do you have like support, are there support groups for people with chronic pain, for their family members, so that they have someone to talk to?
Yes. Yes,
okay,
there are.
Are they here in town?
There are some local support groups.
Okay.
There are a lot of national support groups. There's a lot of information available on the internet
Okay.
now that can help people. But you mentioned coping mechanisms, and that's a simple term that means a lot. And there are physicians that can help, and,
Okay.
and trained experts that can help people to not just cope, but learn to live with what they've got.
Great. If you had any advice for someone out there watching who have had pain more than 6 months, maybe seen a lot of doctors and have just given up because they just don't know what else to do, what advice would you give them?
Well, the first piece of advice I'd give them is be willing to accept new ideas for treatment.
Okay.
They're used to being treated in a certain way, and that's mainly because their doctors have been trained how to treat pain in a certain way. We're learning more and more about what chronic pain is every day, and we have to be willing to throw out the old but maybe convenient ways of treating and accept new ideas. And that's hard. That's very hard for patients to be willing to accept the fact that I may recommend that they stop a certain pain medication as part of their path to getting better. So be willing to accept new ideas is first and foremost. And then second is get involved. Get involved with your doctor. We talked about time issues before, about how waiting rooms get backed up. When you sit down in that little room with that doctor, that's your time with that doctor. Become an active part in the solution. Come ready to discuss your problem, ready to discuss results.
Write things down, have points that you want to make.
That's a great point. Write things down, write down questions you have.
Okay, I'm sorry, go ahead.
There's nothing better than sitting down in a room with a patient and really getting into a discussion that shows that they understand where we're going.
And if he or she isn't meeting your needs, then you can go to someone else. You can find someone else that will take that time you need to listen. There are doctors that are great about that. So I want to thank you so much, Dr. Keck, for your time and all the information that you've given, and I appreciate what you do for all those who suffer from chronic pain.
You're very
we're
welcome.
going to be right back. We're going to leave you with some of those websites and phone numbers for some of the national help that you might need. We're going to be back with 2 patients who suffer from chronic pain, and we'll find out how they cope with their situation in their everyday lives. Stay with us. Welcome back to Healthy Living. With me now are 2 chronic pain sufferers. I have Phyllis Robertson and Rob Prewitt, who daily live with chronic pain. And we're going to just talk a little bit about what that's like. And I want to start with you, Phyllis, to talk about when did your chronic pain begin, and did something happen to bring it on?
Oh, I think maybe the traveling. I worked with state parks for 15 years and drove a lot, sometimes 1,000 miles a week if I had projects scattered all over the state. So I think that's when it started, when I was driving a pickup truck so much.
Pickup truck.
And I learned maybe when it started just to give it time and lay down 24 hours, and I could kind of keep it under control. And then it just kept getting longer and longer periods of time it took to get back up.
And the pain is then in your back?
Lower back,
Lower
right,
back.
right.
Brought on by sitting for long periods of time, maybe? And
I don't really
Yeah.
know. It may just be genetic also. It's called stenosis of the spine,
Okay.
which is a swelling around the spinal cord. And I don't know that there's surgery to do about it, but I didn't want to think about surgery anyway. Too many of those don't work.
Too many of those. And you know, you don't want to do that until there's absolutely no other
Exactly.
option. What about you, Rob? When did yours start?
Mine started about 4 years ago when I was getting ready to turn into a job site and got rear-ended about 65 miles an hour.
Oh, my goodness.
And after that, we had no feelings in my legs or anything for about a week, and then it's just gradually, it's taken over a lot of the everyday tasks I used to do. Numbness in my legs all the way up to the back of my neck, and headaches and things like this. We even went to Louisville to the spine specialty center up there, and had tests ran and everything. And of course, they were saying that they wasn't really showing anything and things like this. And then gradually, we had to go through doctors here that's been working with me for about the last 3.5 years, and we're trying to slowly, take every day. You just don't ever know what it's going to be like when you get up in the morning.
So
And
4 years for you this has
at
been
least,
happening.
yeah.
And how many years for you, Phyllis? How many?
Oh gosh, I guess it probably started 6 or 8 years ago.
And so you say that, and it doesn't seem like a long time. 4 years, 6, 8 years. You know, my child is almost 12, and that has flown by in my life. But when you're hurting every day, that's a different story, isn't it?
Very.
Very. So what were some of your symptoms? How did you, well, you told me you had the lower back pain.
Lower back pain, and I think most everybody has that at some
Right.
time or another, but I learned early that I could control mine, and then I'd have periods when I was pain-free, essentially.
Mhm.
So that went on for a long time, and just managing it by staying off of it a day, maybe a couple of days, and then those periods got longer and longer, and I realized
So you were down. You had to lay down,
Exactly,
and that was
exactly.
it. No getting up for 24 or 48 hours.
right, right.
So it
And
really took you
worked
out for those 2 days.
Exactly.
And that was worth it. I mean,
It-
that was worth
it
it. I'll lay
was.
down for that amount of time if that's what it takes. But did you see lots of doctors? I mean, once you finally thought, okay, this isn't going away, how many doctors roughly do you think that you saw before you went in to try to get help from pain management?
I probably went through probably 6 to 8
6
at
to 8.
least, yeah.
Wow. How about you, Phyllis?
I only went to one. My doctor's pretty aggressive about sending
Uh-huh.
you somewhere else
Well, good.
if it's not working, and I realized I didn't want pain medication. That was not the treatment I wanted. And Dr. Keck had come to Princeton, to our hospital, Caldwell County Hospital, one day every 2 weeks. So my doctor referred me there.
So he was pretty quick on the. He was
Yes,
pretty
he
quick on the
was.
take.
I think because he's had so many back problems.
Well, that helped you probably.
Exactly.
If he suffered with it and knows that, then he's thinking, oh, and it's been more than maybe the 6 months that they had said. 6 months is probably needing other.
Well, I think it came around when it was time for my
Okay.
yearly checkup.
Okay, and you'd still been hurting.
Right, and going to him once in a while for that, and we both realized it was not going to be better without
Right.
some more direct treatment.
Well, that was good for you because a lot of people
So-
aren't that lucky.
That's true, but he's very aggressive about sending you
Good.
to another doctor if
Good.
he doesn't see exactly what's going on. And then Dr. Keck sent me for physical therapy.
Okay. But what happens is, like with you, Rob, you were bounced maybe around from 6 to 8 doctors
Right,
that weren't quite
right.
as aggressive as the one she had. What was that
Right.
like?
It was after a while, it was to the point, like Dr. Keck was saying a while ago, is after a while it gets to working on your mind. And it's like, all right, is it in my head? I can't sit more than probably 30 or 40 minutes at a time without just excruciating pain all the way up to my neck and my leg. We went through the pain patches. We went through injections. We went through physical therapy. I actually had physical therapists tell me that I just need to go home and not do anything. I shouldn't be working. I shouldn't be doing anything. Anybody that knows me knows that I'm not going to sit around. And probably the thing that's helped me more than anything is at least trying to get up and go. But it's, you know, we do take pain medicine. We do take muscle relaxers, things like that, different types of medicine. I don't want to take them any more than anybody else does. But it's gotten to the point, if I'm going to function, I've got to have something to help me to do it.
Is surgery an option for you?
No,
No.
no. And as far as saying it's going to get any better, they say it's not. There is some areas that it might be bulging disc, it might be pressuring, you know.
A nerve, right.
And when you're working, you don't know. Sometimes your limitations are you may go farther than what you should, and it reacts to
On a good day,
you.
when you can go, you want to go.
Yeah.
Right? Because it's a good day, and I want to do something.
Right.
Do you pay for that the next day?
There's a lot of times we do.
Right, a lot of times you do. So, you talked about things you can't do anymore. How has your life changed now? How's your daily life different?
I'm an avid outdoors person, or was. I love to hunt. I love to walk out in the outdoors. I was never a type of person just sat around and said, I'm not going to do something because I can't do it. But I mean, when I would sit in a deer stand for 4 or 5 hours, I'm lucky to make it maybe 45 minutes. And that's discouraging. And there's a lot of people out there that, you know, that's got disabilities and stuff. And now I can say I know how they feel, even though we're not classified as being disabled. But emotionally, it works on you. It really does. I can't do the things I used to do, inspecting houses or whatever. I try to do some remodeling and stuff to keep me going. But it works on you.
So what about you, Phyllis? How is your life different?
I'm a gardener, an avid gardener, and I think not being able to take care of my perennial beds and work in the yard was, and I have 8 grandchildren from 28 down
God
to
bless
5, and there were a lot of things that I have always done with the children that I was missing. I wanted to be a part of their lives. So I think probably that it's just given me my life back as I knew it.
The treatment that you received?
Yes, the treatment that Dr. Keck has done for me.
Well, we'll talk a little bit about your treatment, but I want to hit what Rob had said. It's not just physically, it's emotionally, and how your family and your friends have played a part in trying to help you cope with what's going on in your lives. So either one can address, you know, how that.
Well, mine have been very supportive. I've never felt emotionally strained about it, and it could be just because it didn't go on so long, that we did something aggressive pretty quick. So actually, I didn't get into that going from one doctor to another and different answers and different opinions. Mine came pretty quick. So that's why I was so thankful to have gotten to Dr. Keck.
What about you, Rob?
I think ours is it's the hard part is that they're not used to seeing me this way. I mean, it's, you know, they say, yeah, we understand and all that, but you could still, you know, there's times that you look at I've got a 21-year-old, he loves to do things and things like that, and I sit there and say, well, you know, I used to be able to do that. And it's
physically,
hard.
you look in great shape.
I wish I was. I wish I was, because there's times that I might pick something up and there's a sudden jerk or whatever into my shoulder or something, and I mean, it's just excruciating pain that it feels like somebody just tore your shoulder off. That's what the hardest part is yes, I used to be physically able to do a lot of things and wasn't afraid to ask for help when I wanted to lift something or whatever. I never asked for somebody like my son to come and help me or whatever. I never had to. But since
You're
that
the dad.
wreck, yeah,
I'm the dad.
exactly. And since that wreck, it's been real hard. It's been real hard.
Do you hold, this just came to me, resentful feelings for the person that rear-ended you?
As a Christian, I hope I don't, but I can't say I don't.
Right. I can't say that I wouldn't either. That moment changed your life, and that.
I can't ever get that back.
No, and now you're at that point where you have to just do what Dr. Keck said. I have to cope, and I have to go on. But there are the treatments, and so I wanted to talk a little bit about the treatments. What you mentioned injections, and it's given your life back. Tell me a little bit about what Dr. Keck has done.
Dr. Keck, I suppose they're called epidurals, but it's an injection in the spine, a steroid type. I think there are maybe 3 or 4 different solutions that are injected, but mine is immediate, and then I just keep returning for as many series as he thinks I should have, and then for several months I'm in good shape.
Okay.
But it's something that it is going to come again.
And you know it's
I
coming.
know it's coming again, and there are a lot of things that I can't do now. Like moving furniture and refrigerators, or I do antiques. I can't lift and I can't carry now like I used to. But I try to just be thankful for all the things I can do.
Right. And what about you, Rob? Did you receive the injections like
we
she
started the injections and stuff, and it just did not help us at all. The pain was too great that it just wouldn't take. And Dr. Richardson and I, which is my physician, that's the reason why she was to the point of saying, she wanted me to go to like Louisville and stuff to try to see if there was something that they were not seeing.
She's a pain management specialist as well.
Exactly.
Mm-hmm.
And that's the reason why I did. It wasn't anything against her or whatever. Of course, my wife, she was always, are you sure there's not anything else we can do? I have to trust the specialist. I mean, all I know is what I can and cannot do. There was months there wasn't maybe one night every other week or whatever that I might have got a full night's sleep.
Mm.
There's a lot of nights that I would go out on a job site that wasn't occupied and work at night because I couldn't sleep and because I hurt so much. And it's a whole different ballgame.
Well, if I'm going to hurt anyway, I might as well be doing something.
Exactly.
So you mentioned excruciating. Describe, that's a word that people say, okay, excruciating. I know what that feels like. That hurts real bad. But there's a whole different level to it. That if you could just describe what that's like.
I think the explanation that Dr. Keck had a while ago, where the customer or the patient made the comment about taking a piece of barbed wire and pulling it out of your leg, and that's how bad it hurts. I mean, and then I end up starting to get migraine headaches and stuff like that. If I try to lift anything more than what I really should, the next day I know that it might be a migraine headache, it may be numbness in my leg or burning, to where if I try to get up on a ladder that I can't feel my foot actually get up on the ladder. It's unbearable at times, and it's hard to explain. I mean, but I think
I'm thinking, where does that term come from? Like barbed wire. I mean, I don't know if it's because people sit and they hurt so bad and they're thinking, and when someone says, what does it feel like? And you just think, I think of this crazy thing that would be really, really awful. And that's what I'm trying to tell you. Mm-hmm. And I'm trying to explain to you what this is like, so you come up with barbed wire pulling out of your leg, and you talked about your shoulder. Mm-hmm. Did yours progress? Because you started in your back, and he talked about how sometimes if it's an ongoing thing, that it can move from place to place.
Yes, mine has been very aggressive as far as proceeding to other areas of my body.
What about you? Does yours stay
No, mine, I have 2 separate problems. I also have an inflamed bursa in the left hip, and it's an area that covers the muscles, and that becomes inflamed. So he treats that as well as the back. And
what's he do for that?
Injections. Okay. Injections. Just different areas and different levels of treatment. So I guess if I had any other pain, I'd go to him for that too.
Did you, and let's get back, I'm sorry, we didn't get to all your treatment. We said the injections didn't work. Mm-hmm. What else are they doing for you?
We were doing physical therapy and things like this, trying to different, like the cold compresses, compacts, the heat, ultrasound type massages, things like this, and they just would not take. Believe it or not, being up and moving constantly, a lot of people don't, they think about that. They say, well, if you're hurting so bad, it's when you're sitting still mm-hmm. and not moving and things like that. If I'm up and moving and doing things, it's not as painful. We are on strong pain medicine every 4 to 6 hours. And,
Every day, 4 to
yes.
6 hours, you have to take pain medicine.
yes, pain medicine, and if my muscles really get to hurting me really bad, then I have a muscle relaxer that we use also periodically. I will not sit there and take this medicine if I don't need it. I mean, there's times I've tried to back myself off of some, and I can tell it. I mean, it hurts. And
So can you work?
I do the best I can. I mean, there's times it may take me 9 o'clock or 9:30 to 10 o'clock in the morning to get going.
What does that do financially? How does that work with your?
Our family has actually been struggling ever since the wreck, trying to make ends meet, pay medical bills, things like this, and it's been difficult.
Which it just seems so compounding, because okay, I'm hurting, that's bad enough. Then I can't work, so I can't pay my bills. So then the depression sets in, and then when that sets in, it seems to grow.
I was pretty fortunate. Actually, my pain didn't become too acute until I was ready to retire. Took early retirement, and I was glad I could do that. But it seems like then after that, and maybe it's because I did different type work, I don't know, I do a lot of volunteer work. And like I said, a lot of gardening, and it just, when I was in pain, I just got off of my feet. I was not in pain unless I was up and around.
So again, each person is different.
Right, and hearing Mr. Prewitt's stories make me realize how fortunate I am, that it was maybe just genetics rather than an injury.
Well, I have this question I meant to ask Dr. Keck this question. Have either of you ever heard, it's all in your head, it's not real? You know, you can't be hurting like that all the time. So, I mean, not only from people, but from doctors as well.
I don't think I actually heard that it was in your head. It's the frustration of not knowing what is causing it, is some of the doctors and stuff. Now, it might have been said behind my back. I don't know. That's beside the point. But no, doctors that I actually dealt with and stuff, they were at wit's end and decided that that was no more that they could do, and it was time to try to send me somewhere else.
And how do you cope with when people don't know what's wrong with you? You know, what do you do with it?
That's when it starts working on your mind,
Right.
like maybe it is in my head.
And I've been there. I mean, I have, a condition, and I've had a doctor tell me that she could find nothing wrong with me and that I needed to see a psychiatrist. And I left that place in tears, because that's devastating, because I knew that I was hurting. I could feel the pain, and I knew that it was real. But like you said, Rob, when you go to a doctor, you trust because they're doctors. And you forget sometimes that they're human and they don't have all the answers. And I just was so depressed and down because I couldn't figure out what was going on. Then you would go home and think, okay, that's all in my head, and I'm just gonna, it's not real, and I'm gonna will it away.
Right.
And that doesn't work either.
That's when you have to really also trust in the Lord. And I've done a lot of praying, and I can tell when it's sincere. And I mean, there's a lot of people out there that says, that doesn't have anything to do with it. I feel like it does, and I've had to deal with it because of a lot of praying, and not necessarily all the medicine, but also the will of trying to get over it.
The will of trying to get over it. Well, I wanted to say, what do you do outside of your treatments, your injections, and all of the things that you're trying? And you are 6 to 8 years in, as well, and he's 4 years in.
But I continue my physical therapy every day. The things they taught me to do in physical therapy, I continue every day, and I think that makes a lot of difference. In strengthening back and stomach muscles, I concentrate on those areas so that it will keep my back in line. But it's not a matter of it's like Dr. Keck said, you have to be a part of the program.
So you have to keep up your regimen.
Oh, yes, yes.
Every day
I walk,
to help yourself.
Right. I do my part.
What about you, Rob? What do you do to?
I still, got a farm up in Crittenden County that I spend time up because of peacefulness and being able to walk. And then, you know, my wife gets out and walks with me, and I try to keep my strength up and everything that way and stuff. And like I said, a lot of times I'm having to, even though I'm in the pain, having to take the pain medicine and stuff, I don't sit around and quit. There's times that I do have to lay down and do whatever, but if I can get up and go and whatever, then I try to at least build my strength that way and stuff.
So if you had any advice for anyone out there watching who, whether it might have been hereditary or they've been in an accident and they're suffering at home, what advice would either of you give?
I would definitely suggest talking to a physician, your pastor, or whatever. And if you've got doctors that says they're at wit's end, ask them, you know, where can you send me? You know, where can you help me go that they might be able to tell me what's going on?
I've given Dr. Keck's telephone number to any number of people. I just think he's done wonders for me, and I really suggest that if you have chronic pain, and most people think of back pain when they think about pain management, but there's so many other kinds of pain, I understand, just visiting other patients. So anytime there's pain that doesn't go away in just a little while, I think they should call Dr. Keck.
Or another local
Physician, yeah.
pain management
Well,
specialist?
we don't have a pain management in Princeton.
Oh, that's true.
Except
Okay.
when he comes one
okay.
day every other week.
Okay.
So I suggest people see him when he comes to Princeton.
All right. Well, I want to thank both of you for being here. I appreciate your stories. I hope that it has helped someone who's watching, that if they are suffering from chronic pain, that they do not do it alone, that they reach out and try to get some help, whether it be through counseling, because I think that counseling may be needed as well to help deal with the emotional aspect. Thank you both for joining me.
Thank you.
Like I said, chronic pain is a real problem, and for some it's a debilitating condition, but there is help available, and so please reach out and get some help and don't suffer alone. For Healthy Living, I'm Tammy Thompson. I'll see you next time.